So we're looking here at a calcaneus. We have the superior aspect here. It's a right calcaneus. So we're looking down from above on a right calcaneus. And so if we just turn it over so that we are looking at a posterior point of view to begin with, you can see, these holes here are just where there used to be nylon string to hold the bones together. So they would have been coming out the back here and just tied together. So what we've got on the posterior surface, hopefully you can see a kind of jagged line here. That line is separating this superior part here, which is the surface for the bursa, and then from this surface here, which is the surface for the calcaneal tendon. So the surface in the middle, between this line and then this one, is the surface for the calcaneal tendon, and then where it gets rough, below that second line, is the surface for the fibrofatty tissue. So we've got bursa, calcaneal tendon, fibrofatty tissue, and that's from superior to inferior on the posterior surface there of the calcaneus. Now then, if we have a look again at the superior surface, so we can see on the superior point of view, we've got a great big articular facet here. That's the posterior facet for the talus. Then a bit anterior to that and medial, we've got a middle facet. And then just anterior to that, I'm not sure how well it's not showing up too badly here. Here we've got an anterior facet. And please note that the middle and anterior facets are connected, whereas the posterior facet is separated from them by this groove, which is the sulcus calcaneus. So a sulcus is just a groove on a bone. The sulcus calcaneus is that groove on the superior surface of the calcaneus. Now then, if we then have a look at the medial surface, if we just turn the calcaneus over, so we're looking at the medial point of view, that's the sustentaculum tali, and you can't miss it. It stands out incredibly well. Look how big it is. So when you're just looking at a calcaneus on its own, you can't miss it. Remember, it's on the medial side, so that tells you which side of the, tells you how to orientate the bone immediately. Just on the inferior surface of the sustentaculum tali, that's the groove for the flexor hallucis longus tendon. And now that we've turned the bone over, we're looking at an inferior point of view, we can see here posteriorly on the calcaneal tuberosity, there's a medial tubercle and a lateral tubercle. And note the lateral one, smaller. Then if we move anterior from them, there's a tubercle down here on the anterior end of the inferior or plantar surface, and that's the anterior tubercle. So we've got a medial and lateral tubercle on the posterior part there, on the calcaneal tuberosity, and then an anterior tubercle just there. Now then, laterally, so if we keep turning the bone, we come to the lateral surface. So this would be the plantar surface, this would be the dorsal or superior surface. So looking at this lateral surface, we can see we have a fibula trochlea. Now that's just this little bump here. Now on this particular bone, it's quite small. I'll turn it over. Oh yeah, you can kind of just see that it's a ridge here. But it's bigger on some bones and smaller on others. Now the tendons of fibularis longus and brevis go either side of it. So that's what causes it, but it's sometimes not there at all. Sometimes there's really nothing, just a flat piece of bone, okay? So just be aware that it's variable, not always clear, easy to see. If I want to pin it, I'll try and pick a bone that's got a really good one. So superior and posterior to that, just here, there's a roughened patch, and that is the tubercle for the calcaneofibular ligament. And again, it's not always obvious, it's not always easy to see. This one's not amazing, but you can see where the ligament was attaching. But you sometimes do get clearer tubercles for that. So that's the calcaneus.